Thank you for opening this short RCSI presentation on evidence-based meditation practice to limit anxious thinking. When an anxious thought arises, it can activate a number of other fears, worries, memories, and emotions, and this can all lead to anxiety. The goal of meditation is not to stop this first anxious thought. The aim is actually to prevent the first anxious thought activating others. Much like dominoes, if we can stop the first domino from falling at the start, we can then prevent the rest from falling. This can limit anxiety. We can then use meditation practice to stop these dominoes from falling. There are many types of meditation practices, such as mindfulness, for example, which can all be very effective. However, we will focus on the one that we have researched, which we call attention-based training. In this slide, I will show you the basics of attention-based training. We begin by assuming an upright posture, nothing fancy. In order to stop the initial anxious domino falling, we need an anchor to hold on to. Each time we become distracted by thought, we simply return to this anchor. We recommend one of two anchors. For example, a mantra, which really is a group of words such as I am here right now, or I am here now. You simply repeat this mantra as you inhale and as you exhale, over and over again. If you choose the breath as an anchor, you can return to normal breathing each time you become distracted. Remember that the goal here is not to stop thinking. You simply come back to your anchor, either the breath or the mantra, each time you become distracted by thought, emotions, sensations, or memories. Please try to choose one anchor. Set your timer for 2 minutes, which we recommend at the beginning. Choose your anchor, again, mantra or the breath. And remember, there's no need to empty your mind, just focus on your anchor. You might have to come back to your anchor 100 times in 60 seconds. That's fine. When your timer goes off, you're finished. I'd like to just briefly introduce the importance of regulating stress response using attention-based training. We recommend that you use this practice daily in order to self-regulate. You can see in this image on the left that stress overactivates the emotional center in the brain and inhibits logical and critical thinking. However, after 2 minutes meditation practice, we can reverse this process and calm the heart and the brain, restoring cognition, as you can see from the example on the right. Sometimes we are just too anxious to simply sit in practice. During these times, we engage in another attention-related practice called the body scan. We use the body scan to get the mind and body settled prior to practice. As we can see from this slide, the body scan meditation is a member of the concentration and attention style of meditation practice, just like attention-based training. In this case, however, we place an emphasis on areas of the body while breathing normally. There are many benefits to the body scan meditation. So it can help calm the body during anxiety, stress, pain, frustration, and discomfort. It also prepares the mind and body for your attention-based training practice. And it's actually quite useful for insomnia. We recommend practicing attention-based training in the morning and the evening. Simply start with 2 minutes practice. You can also use it to help with stress during the day. If you like, you can use the body scan before your practice to help you calm. We've attached a 10-minute guided body scan audio file with this presentation. So now let's practice a short body scan meditation. Assume an upright position if you can, otherwise lie down flat on a bed or a sofa. And take a deep breath down into the toes of your left foot. See if you can feel your big toe. Get a sense of your left foot as one unit. Continue to breathe as normal, and remember that each time you become distracted, simply return to the breath or the area of the body that you're focusing on. Next, bring your attention to your lower leg. Move slowly up and relax your calf muscle until you reach your left knee. And from your left knee, then we move into the thigh muscle on your left leg. Again, we actively relax the muscle. And we slowly move into the left hip, across the pelvis, and down into the toes of the right foot. Can you feel the big toe on your right foot? Try and get a sense of your lower leg, including your foot, from your knee right down to your toes. Now bring your attention slowly up through your thigh muscle, again relaxing the muscle. Slowly up into your right hip. And then we move around to the base of the back. We will move slowly up the back, either side of the spinal column. And as we move, we will consciously relax the muscle here. Move up slowly either side until you reach the shoulder blades. As we reach the shoulder blades, we move over into the left shoulder muscle, again consciously relaxing the muscle here. Before moving down into the fingers of the left hand and the thumb. Get a sense of your whole left hand, your wrist, your upper arm, your elbow, the muscles of your upper arm. Feel your arm fall heavy from your shoulder as one unit. And now we'll move from the left shoulder across to the right shoulder. And again, we relax the muscle here. And from the right shoulder, we move down into the fingers of the right hand and the thumb. And we move up through the whole hand, the wrist, the right elbow. Relax the muscles of the upper right arm. And feel your whole right arm as one unit hanging from your shoulder. Next, bring your attention to your neck, the back of your neck. Feel the weight of your head as it rests on your neck. Relax the muscles and tendons here. And now bring your attention to your jaw muscles. Relax the muscles here. Move up either side of your face to your cheeks, your temples. Smooth out your forehead and relax your eye muscles. From here, then we move around to the back of the head and we move slowly up to the scalp at the top. We feel the whole head as one unit as it sits heavy on top of the neck. And finally, we take one deep breath in and get a sense of your whole body from the top of your head down to your toes. And exhale slowly. And that concludes the body scan meditation. Here's a list of additional reading if you're interested in reading more about the topic. Thank you for listening to this presentation from the Centre for Positive Psychology and Health at RCSI.